Hi, my name is Rachel Simeone, and I will be discussing the topic of stem cell research. Stem cell research is a fairly new phenomenon that has created a polarizing controversy across the nation. If I could send a message to the next United States President and Congress, I would address the political and ethical issues surrounding stem cell research and propose a plan to resolve these issues. Stem cells have the ability to differentiate into all different types of cells in the body. Therefore, they can be used to treat diseases such as Parkinson's, Alzheimer's, heart disease, and diabetes. The controversial issue around stem cells is where they originate. Most of the embryos used to harvest stem cells have been left over from in vitro fertilization, which creates embryos for the purpose of reproduction. And also, somatic cell nuclear transfer occurs when a researcher will take the nucleus from a donated egg and implant it into the cells of a patient, creating a stem cell line unique to them, which reduces the risk of immunorejection. This is also controversial, though, because egg donation and cloning are current controversies that are on the rise. Stem cells can also be harvested from adults, but their potential is limited. Therefore, they are not able to cure as many diseases. However, umbilical cord blood has been proven to produce stem cells that can be used for research. There is no rejection, and then there is no harm to the mother or the fetus. Therefore, the controversy surrounding these types of stem cells is very minimal. There are many plans already enacted, such as Bush's President's Council on Bioethics, and the National Institute of Health has created a program that will also monitor researchers. My plan would be to inform the general public about what stem cells are so that they have a basic understanding and of which to form their opinions. I would also like to correct any misunderstandings such that using embryos from in vitro fertilization is murder. This is not considered murder because the leftover embryos would be either frozen indefinitely or destroyed. Therefore, the right to life is not violated whatsoever. I would also like to place more emphasis on the cord blood. I would like to make a program so that in every hospital, whenever a child is born, the parents are informed of the possibility to preserve the cord blood. And also, I would like to make more banks so that there would be a place for these parents to store them, therefore making it more easy and making research possible. Also, 60% of in vitro patients were willing to give up their leftover embryos, however, only 2.8% did. Therefore, I would also like to make it easier for them to donate their leftover embryos by setting up donation programs in all in vitro clinics. Stem cells have the potential to cure many medical diseases that are now considered terminal illnesses, but the controversy surrounding these issues must be resolved before this life-saving research can commence.